Hello everyone. Today we will discuss about the higher topic in pharmacology for NEET PG exam and INI-CET and FMG exam. So today's topic is HIV entry inhibitors. So let us discuss in detail about each drug. So we will discuss HIV entry inhibitors with the help of this figure. So first step for the virus is attachment to the primary receptor, and that is GP120 or glycoprotein 120, which binds with the CD4 cell. So glycoprotein 120, it binds with the CD4 receptor. So first step is attachment to the primary receptor, and that is binding of the GP120 or glycoprotein 120 to CD4. Second step will be conformational changes in the CD4 cell. So after binding of GP120 to the CD4, CD4 cell undergoes conformational changes. So this is the second step where you can target the CD4 cell with the help of the drug. So third step is the CCR5 and CCR4 co-receptors which are being targeted by the drug. So pre-hairpin conformation, that is the next target, and glycoprotein 41, that will be targeted. So the drugs which targets this GP41, that will be the last stage, and that is known as membrane fusion or hairpin conformation. Now let us discuss each drugs in detail. So first step is attachment to the primary receptor, and that is the inhibitors which targets the GP120, and the drug is fostemsavir, as this is the first step. So you can remember it in that way, that is it is a fostemsavir. Second step will be inhibitors which targets the CD4, and that is ibalizumab. So this you can remember like I bind after attachment, and this is the second step. So this drug is a ibalizumab. Now next is the drug which targets the CCR5 or CCR4 receptor, and that is the inhibitors targeting this co-receptors maraviroc. And the last step is inhibitors which targets the glycoprotein 41, and that is enfuvirtide, which inhibits this membrane fusion. So this drug is a envelope fusion inhibitor, or you can say this drug is a fusion inhibitor. So let us summarize this HIV entry inhibitors. So first step is attachment, GP120, that is being targeted, and the drug is fostemsavir. First step, that is the mnemonic, and you can remember it easily as a fostemsavir. It is the first step, so it is a fostem. Second step, post attachment, that is after binding of the GP120 to the CD4. The drug which inhibits this target is a ibalizumab. So I bind after attachment, so that is ibalizumab. CCR5 co-receptor, that is being targeted by the maraviroc, so that is the drug. Glycoprotein 41, that is being targeted by enfuvirtide, that is fusion inhibitor. So EN stands for envelope and FU stands for fusion. So this way you can easily remember that this drug is a envelope fusion inhibitor, and VR stands for it attacks on virus. So this is about the HIV entry inhibitors. Now let us discuss this case MCQ. A patient failing first line antiretroviral therapy is found to have a specific viral strain mutating at the GP120 attachment protein level. A drug that targets this specific attachment step to prevent initial host binding is indicated. Identify the drug. Maraviroc, ibalizumab, fostemsavir, and enfuvirtide. So we have already discussed the first step, that is being inhibited by the fostemsavir. So GP120 attachment, that is being inhibited by the fostemsavir. So correct answer here is the fostemsavir. So this was about the HIV entry inhibitors, the drug targets with the help of very easy mnemonics. If you like this video, then subscribe my channel and follow for more such pharmacology related videos. Thank you.